Good afternoon, everyone, and welcome, welcome, welcome. And thank you so much for joining us from across the continent and beyond. My name is Sibulele Sipaca Nomganga, and it is my absolute pleasure to be moderating this conversation, very, very vital conversation today on people's voices on African health sovereignty. So as we look forward to the Africa Forward Summit that's happening in Nairobi in the next 2 weeks, we find ourselves at a critical crossroads. The African Union has adopted the AHSS. Am I echoing? Can everyone hear me?
Yes, perfect. Sibu, you are good. You're okay.
Okay, great. So as we look forward to the Africa Forward Summit in Nairobi in the next 2 weeks, I believe we find ourselves at a critical crossroads. The African Union has just adopted the AHSS, which is the Africa's Health, Security and Sovereignty Agenda. And that signals a really bold new era that we're entering into, where universal health coverage and pandemic preparedness are really no longer just aspirations, but they're really matters of urgency. And so today, this webinar is about ensuring that sovereignty is not just a buzzword that we go on about at plenary conversations or sessions like this one. And it's really about us beginning to bridge the gap between policy and people, and amplifying the perspectives of civil society, of course, and communities that we find ourselves in, which are, of course, the heartbeat of health diplomacy. So our objective today is simple and quite clear, and that is to ensure that the partnership between African nations and France is responsive to the actual needs of the people. We often hear the word health sovereignty and health solidarity discussed as if they're in competition, as if they're at odds with one another. But today, I really want to, and I'm hoping that we're able to demonstrate that actually they can be quite complementary, and that you cannot have the one without the other. And you cannot have meaningful solidarity if African nations aren't empowered to lead their own health futures. So, because civil society often has very limited seats at these official summit tables, this webinar serves as our collective megaphone. This is our moment to shine. We are here to refine our recommendations and ensure that our leaders hear us loud and clear. Investments must follow people, not just institutions. And so we are going to be hearing from a range of speakers today, very esteemed colleagues who are really at the heart of making sure that we get to where we need to be. I would like to first get indication if my opening remarks speaker, Dr. Peter Bujari, is already here. Could I get indication that he is here? If not, I am more than happy to move on. So Peter Bujari, Dr. Peter Bujari is here. And if you will allow me, everyone, to please read out his very short bio. Dr. Peter Bujari, Reverend Dr. Peter Bujari, is the Executive Director of Health Promotion Tanzania, whose mission is designing and implementing innovative community and national health interventions on maternal, newborn, child, adolescent health. Dr. Bujari is a medical doctor and a public health specialist with international and national experience in health leadership, advocacy, systems, strengthening and monitoring and evaluation. He is also the chairperson of Action Africa, which is a network of African-rooted organizations that leverage their connections and collaborations across the continent. Dr. Peter Bujari, I'd love to welcome you to this webinar. And without wasting any time, I'd love to hand over the mic to you. Thank you.
Thank you very much. Thank you very much, moderator. I wanted to pronounce your name, and then I'm not really sure I will make it. So apology for that. Let me first acknowledge the presence of Honorable Dr. Robert Pukose. Let me also acknowledge the presence of Honorable Peter Njume, and also Madame Sarah Witt, and of course my colleague Action Directors who are present or their representative in this convening. Also acknowledging presence of moderators and thanking participants all who have made time to participate in this very important webinar. My opening remarks are going to be pretty rather short, and I'll quickly touch base on three things. One is the health as a strategic focus, as a strategic sector rather than a social sector. And so moving forward, health sector needs to be recognized as an investment sector and not as a social sector. And this is because health sector basically enhances human capital, improves labor productivity, also reduces economic burden, and therefore increases household and national savings. If we spend more on health, prevention particularly, then we have productive population. And secondly, touch base on the regional frameworks that our leaders have approved, and therefore they do guide our policies and investment. And number one is the Lusaka agenda, where I'll touch on the three key areas of focus. And one is strengthening primary health care, where most of the people access the health services. And secondly is improvement on the global health institutions coherence, so that we reduce duplication. And as the moderator says, the money following people. And thirdly is the area of domestic financing, particularly in the area where health financing is decreasing, has been decreasing, and is even more decreasing. This brings me to the Accra Reset, where the focus is on the moving from the aid dependence into sovereignty, and therefore focusing on the actionable reforms in the areas of global health governance, local manufacturing, and also a delivering framework that will allow moving from the lip service into action. And civil society are keen on these fronts. In particular, the Action Forward Summit that's forthcoming, I want to acknowledge in particular the partnership between French government and also the African states to advance the global health agenda, and wanting to plead that civil society organizations' meaningful engagement should continue. And civil society are ready and more than happy to participate in the designing, implementation, and also monitoring public health programs where public institutions are not best positioned to do that. With these opening remarks, I would like to thank all of you again, and wishing good discussion and deliberations on the statement that will come out from this discussion. Thank you very much.
Thank you so much, Dr. Peter Pujari, for that very nice and short and very punchy. And really what I take away from you, and I want to start with the fact that you spoke about the fact that civil society, it is still our responsibility to show up, to engage, and to participate, right? And understanding that our mission is to make sure that we get our governments to spend on this health, especially preventative health, because we know that that leads to productive populations. So thank you so much for setting the scene and the tone for us. Really, really appreciate it. I want everyone to know as well that we do have French and English translation. So please, if you have any issues, do let us know on the chat box. And while I'm on the chat box, I want everyone to please tell us you are here, and I can see people are here. Tell us your name, where you come from, the name of your organization. I see you, Leslie Odendal from United Advocates Network. I see you, Sis Tandy from South Africa. I see you, Linda Nja from ISA. I see you, Wishes Mumba from Malawi. Mamoleti from Lesotho, Yolandi, I see you from Mothers to Mothers. Philip, hello. Solange, hello from Cote d'Ivoire, as well as Fadil from Cote d'Ivoire. So thank you so much all for joining us, and we really hope that this is a meaningful conversation for you. Once again, thank you so much to Dr. Peter Pujari for setting the tone for us and making sure that it leads us into what we should be talking about today. Now, I want to open up our first round of questions for the roundtable discussion. I'm going to introduce our speakers, and not sure if our tech is going to, as I speak about, but before I do that, I think I should be going to Honorable Dr. Robert, but let me just first check. Yes, I should be going to, before opening it up to our roundtable discussion and conversation. At this point, I'd love to hand over the conversation to Honorable Dr. Robert Pukose. Before I give you his bio, I first want to know, have I pronounced that correctly, Honorable?
Yeah, sure, it's correct. Sibule. It's
Pukose?
correct. The pronunciation. Am I on?
Lovely. Okay, so yes, you are on. How do I pronounce
thank
it?
You. Yeah, you've pronounced it correctly. And yours is Subulele.
Okay. Perfect.
Okay.
Yes. So awesome. So already Dr. Robert and I are already acquainted. Honorable Dr. Robert Pukose is a member of parliament representing Endebe's constituency in the Kenyan National Assembly. He is currently serving as the Vice Chair of Budget and Appropriations Committee and former Chair of the Health Committee in the Parliament. A trained doctor by profession and a very passionate public speaker and servant, Dr. Pukose worked in various roles in the Ministry of Health, including as a Senior Assistant Director of Medical Services before being elected to Parliament. This is a man who absolutely loves the work that he does, and we are so honored to have him here today as our keynote address, talking to us about what this all means and where the intersectionality comes in between health security and sovereignty. Over to you, Dr. Robert.
Thank you, Sibulele, and thank you, everyone. All protocols observed, partners and fellow Africans and our friends from the global north, good afternoon. It's a privilege to speak before this webinar gathering as we prepare for the Africa Forward Summit. Today, today's theme, the people's voice on African health sovereignty. It reminds us of our health sovereignty, and it's not just an abstract policy, but it's about the lived realities of our citizens. It's about ensuring that every African, from the village to the city, has an access to dignified, reliable, and affordable health care. The Accra Reset is a clarion call to rethink Africa's health future. It challenges us to break free from dependency and to place African priorities at the center of our health agenda. The African Health Security and Sovereignty Agenda provides a roadmap of ensuring that our continent is prepared, resilient, and self-reliant in the face of global health challenges, just like we had the Ebola and other global diseases. Recently, we had the endemic that affected the whole of the world, and this actually makes us to be prepared. How does this agenda shape our health discussions? We need to do centering of people's voices, and these communities must be heard in shaping our health policies. The sovereignty means listening to citizens, not just experts. And the reset insists that health system reflect African realities, not imported models. We need to also build the African capacity. Our local production of medicines vaccine and diagnostics is essential. Sovereignty means Africa can meet its own needs without waiting for external supply chains. This will be a key focus at the summit on how to scale African innovation. We also need to strengthen our preparedness and our security. The pandemic taught us that preparedness saves lives, and the agenda calls for stronger surveillance, rapid response, and regional cooperation. Discussions will also focus on how Africa can anticipate, not just react to health threats. On financing and health sovereignty, people's voices demand sustainable financing that does not health finances that does not collapse when donors withdraw. Domestic resource mobilization and innovative financing like health access will be central to the summit. Sovereignty means Africa funds its own health priorities. On equity and inclusion, sovereignty must reach the grassroots, women, youth, and marginalized communities. The research emphasizes that no African should be excluded from health access. The summit discussions will Am I clear? I don't know whether I'm getting. The summit will explore how Africans can influence, not just follow, the global health governance. As Kenya, we bring to the dialogue our experience in universal health coverage, our investments in community health workers, what we call the community health promoters, and our belief that health is the foundation of prosperity. The Accra Reset and the health security and sovereignty agenda remind us that the future of African health must be defined by Africans for Africans. And most importantly, it must be shaped by the voices of our people, the mothers, the youth, the workers, and the communities who live the reality of health every day. Let's carry those voices into the summit. Let's ensure that sovereignty is not just a policy, but a promise fulfilled in the lives of our citizens. Thank you.
Thank you so much for those words, Honorable Dr. Robert Pukose. Really to move these policies to promises that are delivered. Thank you so much for giving us an indication of what to expect from the summit, what we at civil society should be looking out for, because that really is important, and really for guiding us in understanding that this must be an African-centered response, that we also need to ask ourselves the questions of, are we ready for domestic resource mobilization? What happens when donors pull out? Really for us to ensure that we are prepared for whatever pandemic we are going to face, and that we are not finding ourselves on the back foot. When we have support of our leaders in parliament like yourself, it just always makes our job a little bit easier as civil society. So thank you so much for
You're
that
welcome.
guidance and for that encouragement. And I am still greeting people on here while I am getting all my roundtable discussion participants ready. Hello, everybody. I see you. I see you. If I do not mention your name, please, I've got a very strict Lucille here on the end, who is on my case about time. Peter Pujari, of course, you had already spoken earlier. Daniela from Italy, I think it is. Jan from France. Hello, everybody. Amanda from Washington, D.C. We see you. Auntie Sissy India. From Ghana, hello. Samuel from Kenya. Hello, everyone, says Gabriela in Kenya. Dr. Mateo, who is based in, I'm not sure where he is based, but hello, Dr. Mateo. Hello, Patrick from France. Yeah, I see you, and I'll keep saying hi. Please do let us know who you are, where you're from, and the name of your organization. So, right now, I would love to call upon my roundtable discussion panelists. I hope you're ready. Can you give me indications of thumbs up? Give me some emotion. Give me some action. Please let me know you are here and that you are ready. Please, please, please give me some love. Let me know that you are here. I see you. Sis Rose, thank you so much for being here. I'm going to now just quickly read through the profiles of our panelists, and then I'm going to get right into it. So I'd like to first welcome Sis Rose, Miss Rose, I call her Sis Rose. Sis Rose Mary Mburu, who is the Executive Director at Waki Health, a regional advocacy organization working to advance health equity access across Africa. Waki Health convenes several civil society networks on health, including Global Fund Advocacy Network, GFAN Africa, the HERE CSO Consortium on Global Health Architecture Reform, as well as the African Civil Society Platform on Health. She has spent most of her career, anyone knows, advocating for stronger health financing, accountable governance, and meaningful civil society engagement in Africa and in the global health decision-making space. She is, by the way, one of Time 100 most influential people of 2026. Championing African health leadership. Waki Health is also a member of Action Africa. Welcome, Sis Rose. I'm going to do everyone first, and then we jump into the questions. Then next, I've got Miss Olivia Ngo, my sister from ISA. She's the founder and executive director of Impact Sante Afrique. Through ISA, Olivia coordinates several large civil society platforms, including Civil Society for Malaria Elimination Network, the Global Fund Advocates Network, as well as the Coalition of Parliamentarians to End Malaria in Africa. She has spent her career mobilizing communities, parliamentarians, and decision makers around stronger health financing, gender transformative programs, and a malaria-free Africa. She also co-chairs the C7 Global Health Working Group. She is also the convening civil society advocacy towards G7 governments. Welcome to you, Olivia. We also have Honorable Peter Njume. Honorable Peter Njume is a member of parliament in the National Assembly of Cameroon and the co-chair and founding member of the Coalition of Parliamentarians to End Malaria in Africa. Officially launched in Accra in April 2025, COPEMA brings together parliamentarians to use their legislative oversight and budgetary powers to drive domestic financing and accountability in the fight against malaria. Honorable Njume is a consistent, powerful voice for prioritizing health in national budgets and for stronger collaboration between parliamentarians, national malaria control programs, and civil society. Welcome to you, Honorable Peter Njume. And we also, lastly but not least, have Sis Carol Nawina. Sis Carol Nawina is Nyirenda is the executive director of Situm Plus, a community-focused organization in Zambia, committed to ensuring equitable access to information, care, and support for people affected by TB, HIV, and malaria. For close to 2 decades, almost as long as I've been alive, Sis Carol has been one of Africa's most respected voices on global health equity, advocating for community-centered policy change at national, regional, and global levels. She's a fierce fighter, has previously served on boards of the Global Fund Stop TB Partnership in the Union, and currently sits on the UNITAID board representing TB-affected communities. Situm Plus is also a member of Action Africa. Welcome to all of you, and I'm so excited to have you all here. And so we're going to start now with our first round of questions. And so first question goes to you, Sis Rose. Which recommendations would you like to address to African and French decision makers who will be gathering in Nairobi for the Africa Forward Summit in the next 2 weeks? What are some of the key priority questions or points that you'd like to get through and across to them? Over to you.
Thank you so much. Good morning, good afternoon, colleagues. It's a pleasure to be here. And thank you so much, Sibu, for this. So I would like to situate my reflection on two realities, even as we go to talking about the recommendations. And the recommendations that I'm going to highlight are organized in 3 buckets. And these recommendations are not recommendations from Rosemary. These are recommendations that a group of civil society organizations have consolidated from a number of processes. So this is what we've been hearing coming out from the One Health Summit that was in Lyon in April, coming out of the World Health Summit, the regional one that was in Nairobi that just ended yesterday, but also coming out of the initial conversations and statements and reflections by civil society that are participating in the C7 dialogue and conversations. And then also today here, we are also very much open to hearing out of these recommendations, what is missing, what else would you recommend? But situating that in 2 realities. The first reality is about what is at stake. Why is this important? And why are our recommendations as civil society and impacted communities important to African and French leaders as they prepare to gather in Nairobi? So the first reality is what is at stake. And what is at stake is exemplified by the fact that around the world, you have about 4.5 billion people who do not have access to health services, to essential health services. And out of those 4.5 billion people, which is pretty much half of the world, a majority of them are on the African continent. The second thing is that then you have about 2 billion people around the world, and without a doubt, a majority of them in Africa and South Asia. And so our continent, looking at about 2 billion people who are at the risk of being pushed into extreme poverty while seeking health services due to catastrophic out-of-pocket expenditure. And there are many examples. I mean, we can talk about the fact that every 2 minutes, a woman is dying because of childbirth complications. We can talk about HIV, TB, and malaria, and the way the shortages of funding the cuts are actually projecting that we will see an increase in infections and deaths. And so that's the first reality. What is at stake is actually people's lives. And the second thing that is the reality is that this conversation and this Africa Forward Summit is happening at a time when the world is thinking about global health reforms, and we are thinking about the global health architecture. And when we talk about this, then we see a tension between solidarity and sovereignty, like you very well mentioned, Sibu. And this is a reality that then makes us say, what do we mean as African leaders are moving more towards sovereignty? How do we ensure that this conversation is not pitting sovereignty against solidarity, but we are looking at the synergy around that, and really defining sovereignty as not cutting the ties, as not separating ourselves as a continent from the rest of the world, as is not saying we do not need international cooperation, but it's saying how this cooperation is done needs to change. What we invest through the financing that comes through this cooperation needs to change. And that is why those 2 realities are important as we go into the recommendations. And so the first thing is to then say, as the leaders gather in Nairobi, a lot of conversations around cooperation seek to have a bias on the economy, a bias on infrastructure, a bias on how can we achieve more economic growth, which there isn't a problem with economic growth. There isn't a problem with infrastructure. But the point is that for us to actually ensure that the 4.5 billion people without access, the mothers who are dying, the deaths that are projected because of funding cuts, must then tell us that we need to do international development cooperation with people, equity, and country leadership as priorities. And that must be at the heart of this cooperation. And that must be at the heart of any health conversations, any health cooperation. So that's the first thing as a preamble, to say that the conversations must put people at the center, must put equity at the center, and must also be guided by country priorities. The second thing, in terms of situating the recommendations and this conversation, is to say that we are here on this webinar because it's important for communities and civil society to meet. And I know here we are not just communities and civil society, we have members of parliament, we have, policy leaders, we have even people working in government entities. But, as civil society, we acknowledge that we do not necessarily have a meaningful space in these conversations. We are not in the room necessarily so. And so this conversation here is also about reclaiming our seat. It's about saying, if we had been meaningfully included and if there had been meaningful engagement in these conversations, this is exactly what we would have said. And so the three recommendations, broadly speaking, there's a lot packed into that, but one is around strengthening health systems to leave no one behind. And this, we recommend that, French and African leaders consider health as a key driver. And Dr. Bujari mentioned this as a key driver for development, as a key driver for security, and also shared prosperity. We cannot talk about shared prosperity without talking about health. One of the statements that His Excellency President John Mahama, mentioned at the One Health Summit in Lyon in April, he said that a healthy and thriving Africa will be a positive force for global progress, not a threat to anyone. And so a healthy and thriving Africa is a positive force. So now is the time to actually invest in the women, in the men, in the children, the adolescents who deliver care, and to ensure that innovation projects everyone, not just the privileged poor. So the whole issue around equity comes in, but also thinking about fighting not just against diseases, but also the intersectionalities of health, poverty, conflict, climate change, and so on. And the second bucket of recommendation is around guaranteeing an equitable health architecture to maintain true sustainable partnerships. We do know that even as we sit here, there are conversations, negotiations about how global health will look like in the future. And the Africa Forward Summit is bringing leaders who have influence, who can actually help to shape how global health architecture will look like, and help advance reforms that ensure that people are at the center, equity is at the center, country leadership is at the center. And so we call upon them and to reshape the global health architecture into one that is fair, inclusive, and that is built on trust. This is where national priorities inform health compacts are established through a whole of country approach, including government, civil society, members of parliament, communities, the private sector. It's all of society. And in the field of research, supporting regional manufacturing means empowering countries to stand on their own strength while remaining deeply connected to its partners. So again, it's about what is guiding where partners are investing, what is guiding where France is investing. Those priorities need to be developed with the people. And the last one is around optimizing financing to ensure global health security. So this is to say that we cannot say that we will achieve equity, that we will close the gap of people without access to essential health services, the gaps in HIV funding, TB, maternal health, non-communicable diseases. We cannot close that with just domestic resources. And that's the reality. And so it's really important to see how do we leverage the funding that already exists to actually catalyze the sovereignty we are talking about via targeted initiatives. And really help, it really is a pathway. When you talk about sovereignty, it's a pathway with milestones. And how do we ensure that there's solidarity where partners are journeying with African nations towards that sovereignty journey? And so at the end, Sibu, I'm ending to say that at the end of the day, it's really simple. It's about, can people access care? Are people protected? Can people live with dignity? And that should be our guidance. That should be our North Star. Thank you. Back to you.
Thank you so much, Sis Rose, for that. Thank you for those recommendations. And at the end of the day, for everything that we are doing, can people get the services that they so rightfully deserve? I mean, and at the beginning, what is at stake? What is the cost of our inaction? And really, like you said, it's people's lives. And so thank you so much for reminding us of that, and for pulling in from different, from your experience around what is going to be most important looking forward to the Africa Forward Summit. Thank you so much for that. And I'm going to come back to you. I want to now jump over to Miss Olivia Ngo. And so I want to ask you a lot, especially because you are the co-chair of C7. So we see that France is co-organizing the Africa Forward Summit and leading G7 this year. Now, in your role, do you see civil society agreeing with the recommendations to shape a more equitable global health architecture? Sis Rose touched on it a little bit. Do you think that the recommendations coming forward are what's going to work for Africa and its people? Over to you.
Yes, thank you, Sibu. Thank you for hosting this webinar, and thank you everyone for being here. I couldn't agree more with Sis Rosemary. Yeah? Sis Rosemary, you should have a seat on that table after that brilliant speech. Yes. So, I mean, I would like to say that it's very striking to us that this year civil society are not only aligned with principle, but we are really increasingly aligned on what the priority should be. On what needs to change and also how. So through the C7 Global Health Working Groups of the G7 that Impact Santé Afrique, ISA is pleased to co-chair with Global Health Advocates, we have seen really strong convergence across organizations from different regions, and especially on critical priority. So this alignment is actually reflected in our C7 Global Health Declaration. And I'll ask my colleagues to put that declaration in the chat so that you can have it, you can read it, you can share it. But we are all very much aligned in that declaration. And this declaration brings together a broad coalition of civil society organizations, of NGOs from Africa, but mainly also from non-G7 countries as well as G7 countries. So all of us from different regions, different continents, have come together with the recommendation for the G7, and those recommendations are very much aligned to what Sis Rosemary was saying on health financing, on governance, on equity. And the elements are really focusing on a more equitable global health architecture, because we really want to make sure that we continue to put equity at the center of whatever the new health architecture is going to be. So there's really a clear consensus that financing must become more and more sustainable, also predictable. And then we cannot continue, of course, to relying on very short cycle of funding, while countries are expected to actually deliver high long-term health outcome. So this means really strengthening domestic resource mobilization, but also maintaining strong international commitment, including the mechanisms such as the Global Fund. And like Rosemary was saying earlier, we cannot end all this disease and the epidemic only with domestic resource mobilization. Sovereignty doesn't mean that we are no longer working in solidarity. So we really need both, because it's a global problem, it's a global crisis, it's not just an African problem. So secondly, we're also very much agreeing to the fact that there's a growing demand for more equitable governance. There are too many decisions in the global health that are still shaped by leadership from countries, insufficient leadership from countries that are most affected, without meaningful inclusion of communities and civil society. So we all agree that that needs to change. And third, there's also a strong call for accountability, not just on commitment on paper, but also making sure that the mechanism that ensure that those commitments are translated into action can actually work, so that we can see real change in people's life. So we all agree on that. And yes, civil society is very much aligned on this. And the question is now how or whether this moment, including this platform and platform like the Africa Forward Summit, will then help to translate our alignment into concrete political decisions. That's where we are now. Thank you.
Thank you, Olivia, for that. And just making sure that we don't forget, these policies are for the people, but the promise must be delivered. So thank you so much for just also highlighting that we are in agreement. We are moving in one voice. We are all saying the same thing. And so this really helps, because it helps us to walk into the Africa Forward Summit space and seat with one voice. And so this really helps. So thank you so much for those words. And now next up, we have a message from Honorable Peter Njume, who was unable to join us, but definitely made some time to share a message for us. So if the tech team could please share the message from the Honorable Peter Njume.
Mesdames et messieurs, chers partenaires, chers acteurs de la société civile, chers leaders communautaires, je vous remercie pour cette opportunité, l'occasion de ce webinaire qui constitue une étape importante à la veille du sommet Africa Forward. Permettez-moi de commencer par une évidence trop souvent oubliée. Sans santé, il n'y a ni développement, ni prospérité, ni avenir durable. La santé est le fondement sur lequel reposent toutes nos ambitions économiques, sociales et politiques. Pourtant, dans de nombreuses régions d'Afrique, des mers fragiles, inégalement financiers et insuffisants priorisés. Mon engagement dans la lutte contre le paludisme n'est pas un hasard. Il est né d'un constat simple et douloureux. Des milieux de vie, notamment ceux des enfants, constituent d'être perdus chaque année à cause d'une maladie pourtant évitable et traitable. C'est cette réalité qui m'a conduit, avec d'autres collègues parlementaires, engagés et cofondé la coalition des parlementaires pour l'élimination du paludisme en Afrique, COPEMA. À travers la COPEMA, Notre ambition est claire. Renforcer l'engagement politique, coordonner l'action des parlementaires et mobiliser davantage des ressources domestiques pour mettre fin au paludisme sur notre continent. Nous croyons fermement que les solutions durables doivent venir de l'intérieur, portées par un leadership africain fort et responsable. Aujourd'hui, alors que nous nous préparons pour le sommet Africa Forward, je voudrais formuler 3 recommandations clés à l'attention des décideurs présents et à venir. Firstly, let us think about financing of our health systems. It is imperative that we engage ourselves in investing in this area through domestic resources. We can do this, it's possible. Secondly, let us put up a very strong international architecture, a world architecture that is going to enable health to be more equitable for all of us here in this continent. Thirdly, let us see how we can reinforce a durable health systems in our various countries. If we do this, we have to understand that we cannot fight malaria or any other disease if we have fragile health systems. We must have solid, resilient, and accessible health systems. This is very, very important. But apart from these 3 axes that I've mentioned, it is also important that all our actions should be centered towards the communities. The communities must be involved, otherwise our actions will not be effective, or otherwise will become ineffective. This webinar, therefore, is a platform, a very important platform. It gives the opportunity for the various communities and civil society to bring forward what they have in mind. They have to share. I will better put it maybe in this way, that it gives sovereignty to everyone here to be able to talk, to share, so that the international solidarity becomes stronger in the fight against malaria. I'm very, very convinced that today we have had a very historic opportunity, that of transforming our engagements into action, into concrete actions, and our words into measurable results. Together, we can win this fight. Together, we can build very strong health systems. Together, we can build a very strong future for everyone to live comfortably. It is a world. It is a fight. Let us all be committed. Thank you all very much.
I don't know about you, but I'm feeling really fired up right now. I'm feeling so inspired and motivated, because when our leaders say it is possible, and they are saying it, we can really move from fragile health systems to strong, sustainable health systems. It can be done, is what Honorable Peter Njume has just said. I mean, if he says it can be done, it can be done. And so really it's on us and making sure that we continue making sure that our voices are amplified, and we are finding ourselves on platforms as this one, and making sure that we get our voices out there. And so thank you so much to Honorable Peter Njume for just reigniting us again and reminding us of what is possible if we just continue on this road of fighting for what matters for Africa. So thank you so much for that. And so last, but certainly not least, for this round of first questions, I'd like to now hand over to Sis Carol. And Sis Carol, the statement we are presenting today calls for investments to follow people and not institutions. And so you are somebody who leads a community-based organization. You work with people living with HIV and other health conditions. And every day you see what works and what doesn't work. What would you think it would take for investments to truly respond to the needs on the people who depend on them most? Over to you.
Thank you very much. And I'm sorry there's something wrong with my video. I've been trying to turn it on, but I don't know. I hope by the end of the call I'll be able to fix it. But thank you for the questions. I hope you can hear me clearly. Hello?
We can hear you loud and clear.
Thank you so much. Yes, so to answer your question, so I would say when we say that investment should follow people, not institutions, I think what we are really challenging, we are challenging a system that has historically prioritized structures, reporting lines, and funding channels over lived realities. From a global perspective and from what we see every day in the communities where I work, this shift is not just desirable, it is necessary. That there should be a shift from communities from down upwards. So for investment to truly respond to the needs of people, especially those living with HIV and other chronic conditions, some fundamental changes are needed. I'll start by saying we must move from top-down design, like I mentioned before, to community-led solutions. Across many countries, programs are designed far from the people that they are meant to serve. Yet communities already know what works. I mean, we are in the communities. Most of the time, we're the recipients of care and we understand what's needed. Our communities understand barriers like stigma, transport costs, long waiting times, as well as the fragmented services. So when communities are involved from the beginning, not just as implementers or recipients of care, but as decision makers, investment become more relevant, more efficient, more sustainable, yes, and more sustainable. So globally, we have seen that community-led monitoring and service delivery can improve outcomes because they reflect the actual needs, the real needs, and not just assumptions that are sometimes made by other institutions. I think the second one I'll talk about is funding. Funding must become more flexible and accessible. Most of the time, resources are locked into rigid structures, short funding cycles, and complex requirements that exclude smaller community-based organizations. Like after the funding cuts that were here, we've seen a lot of these smaller organizations in my country and all over the world closing down. But then these are the very organizations that are closest to the people most in need. If we want investments to follow people, then funding must reach the front lines directly with simplified processes and trust in local leadership. And then there should also be flexibility, which means allowing programs to adapt as realities change, whether it is due to economic shocks, pandemics, or just shifting health needs. Then the other one I think I would say is we need to integrate. Right now, integration is the buzzword. We need to integrate services around people, not diseases. People do not experience the Hello?
You keep coming in and out, but you're still there.
Okay, sorry. Unfortunately, I'm in a meeting at the hotel. I'm using the hotel internet. So yeah, let me just finish off just now. Sorry, so that I don't get interruptions. Yeah, so we're talking about the funding should not be fragmented. A people-centered approach means investing in integrated holistic care where services are coordinated, accessible, and respectful to one person. It is this is not more humane, not only humane, but it is more cost effective in the long term. I always say, as Carol, I don't want to be cut into different pieces. One piece goes to HIV, one goes to TB, one goes to diabetes, one goes to maternal and child health when I'm going to see my grandchild. It should be holistic. And beyond these, the three shifts I've talked about, there's a deeper issue of power. Following people means shifting power towards communities, towards patients, and towards those most affected. It means measuring success not just by how much money is spent, but by whether people are healthier, empowered, and are able to live with dignity. So globally, we already have evidence that this works. We know that. Where communities are trusted, where communities are resourced and meaningfully engaged, we see better adherence to treatment, stronger health outcomes, and more resilience to crisis. So what would it take then? I think it would take courage from donors, from our governments, to rethink traditional funding models. It will take accountability mechanisms that include community voices, and it would take a commitment to equity, ensuring that no one is left behind, especially the most marginalized. Thank you.
Thank you so much for that, Sis Carol. And, Honorable Peter Njume spoke about the fact that it can be done. And you are telling us how it can be done. And that is making sure that communities are at the center of the response. I mean, if communities are at the beginning of the solution, are made a part of the solution, rather, right at the beginning, whether it's solution around programming, solutions around financing, we know that there will be ownership, which means there'll be sustainability. So thank you so much for closing off those and that first round of questions for us for this panel conversation. I would like to remind everyone that the statement has been shared on the chat. Please familiarize yourself with this statement, because we'd like you to sign on to the statement towards the end of our session. So please have a look at it in between and think about, if you have any questions around it or something you'd like to share around it, we'll definitely give you an opportunity for that. And so because we'd like to give our participants here on this webinar an opportunity to give us and share with us some of their feedback to the statement, I am going to go into the second round of questions, but I'm going to ask our panelists to try and keep it short so we can allow for that to happen. So I'm going to come back to you now, Sis Rose. As a long-standing actor of the global health sector reform, what changes would you like to see in the partnerships between Africa and France that are aimed at fostering the regional manufacturing as well as
Yeah, and you are breaking for me, Sibu, but I get the
Sis
question.
Rose?
So can you hear me? Can you hear me?
Yes, I can hear you. Yes.
All right. Yeah. So it's just very quickly, because I'm also conscious that we want to hear from colleagues who are on the call. Around regional manufacturing, local manufacturing, perhaps the only input I would like to add, in addition to everything that colleagues have already mentioned, is that there will be discussions focused on local manufacturing during the Africa Forward Summit. And there has been a lot that the Africa CDC, African Union has put forward as part of the sovereignty journey. And so perhaps it's really how we shape the narrative in saying that if we are looking at transition, if we are looking at greater country leadership, as if we are looking at Africa's leadership, if we are looking to ensure that Africa is not the last in line again when we have the next pandemic, or even now as we navigate the funding cuts, even in the current epidemics that we are dealing with and the conditions that we are dealing with, we have to think about long-term solutions. And local manufacturing, regional manufacturing is one of those elements that ensures that African nations can continue to strengthen the infrastructure for regional manufacturing. And one thing we know is that it's not an overnight job. And therefore, partners like France are really important. Partners, international cooperation is really important in ensuring that we can lay down the infrastructure, we can figure out how we invest and get Africa there, because, it is part of the journey. It is part of the continuum around empowering or strengthening countries to stand on their own strength while still remaining deeply connected to their partners. And so it's part of the pathway towards sustainability, and would like to urge partners to invest in that, invest in infrastructure. And the last thing to say is that we know many African nations are actually we cannot use domestic funding to lay out the infrastructure for regional manufacturing. That's a fact. It's really capital intensive. And there's an argument that, do we want to make sure that facilities have commodities, or do we actually want to use that money for the infrastructure? And so many African nations are going for, partnerships, international corporations, or even are trying to access capital. But one of the other biggest challenge is the rate of access to capital. Access to capital is really punitive for African nations. And so that's the other part to say for international partners, for the African and French discussions. Let us also think about, how do we ensure that there is equity in how Africa is borrowing for the cost of capital towards investing in the infrastructure that is needed for local manufacturing. Yeah.
Thank you so much for that, Sis Rose. Thank you for highlighting to us what's important, but also what are some of the challenges that we have. And that huge capital investment outlay is something that we have to be honest about and see how we work around it, so that local regional manufacturing or regional manufacturing becomes something of a reality in the next few years. So thank you so much for that. And so I know Sis Carol is not in the best of environments, but Sis Carol, if you could just give me one message. If you had a moment with your president or your minister of health, I'm sure you've had plenty, what would you say to them about what's important leading into the Africa Forward Summit and our statement?
Okay, thank you. So for me, I would, I think, take access back to the health sovereignty that everybody's talking about. So I would say, if global health reform is going to work, a person living with HIV should be able to feel it, not just read about it. That is a standard we should hold ourselves to. So when our African leaders commit to health sovereignty, and partners such as France commit to equitable partnerships, communities are not looking for new language. We are not looking for new language. We are looking for the real change in our daily lives. That's where the difference is. You know, I always say, out of all these talks, when people are talking about policies and documents, for us, it's not just about the frameworks and everything. It's a difference between life and death. So the true test of health sovereignty, I would say, just to end, is sovereignty and equitable partnership is simple. It's, for me, does that woman who is in the community, does that woman still have to choose between her health and her livelihood? There should be that difference, or for her to go to the health facility. That's what I would say.
Thank you so much, Sis Carol. And I believe you. I believe that you would say exactly that. I love that. I'm walking away here with, we don't just need to read about it. We've got to be able to feel it. So from paper to the people. Thank you so much for your contribution, Sis Carol. And lastly, to wrap up our roundtable conversation, I'd now like to hand over for a minute or two to Olivia and say, Olivia, as a prominent figure in the fight against malaria and epidemics, which changes would you like to see in the partnerships between Africa and France? Which ones would you like to see improve health workforce condition? Over to you. Olivia? Is Olivia here? Okay, so while we are still trying to figure out where Olivia is, can I get indication that people can hear me or they can hear Olivia?
We can hear you, Sibu.
Okay, perfect. Great. So we will try and locate Olivia. As soon as we've found her, we'll get her to jump back on. But I now feel like it's now bringing us to our question and answer session. For us to, I hope at this point you familiarize yourself with the statement that was shared. I know we're going to be sharing the QR code to the statement as well, because this is a statement we would absolutely invite all of you to send to your respective authorities and leaders in your own countries. And so, do we have any questions in the chat? I'm going to open up my chat now and just make sure that if there are any questions, then we are able to grab that. I am not seeing everyone's questions. And there we go. That is the QR code. Thank you, tech team. You are on it. I like it. Fire. Questions and answers. There is one question and it is in French. There is one question. Could I get tech to assist me with this? And I think it's more pointers than it is questions. Could we get someone to assist with that feedback? I think there's feedback there. In the meantime, if you do want to drop any questions, any feedback, there are currently no open questions. If you did put in your question before, could I ask you to please put it, or your comment, feedback? I seem to have lost my chat and now I've reopened it. I'm told that Olivia's connection was disrupted. If I can get indication if Olivia is back on, while I'm urging, encouraging, imploring people to come on and share with us what their feedback is. If you have any questions for our panelists, please do share that on the chat or in the question and answer section. If I can get indication if Olivia is back, then I am more than happy to bring her back on. Olivia, are you here?
And
She's not
Sibu,
here
there are
yet.
some questions. There are some questions in chat.
I am so I'm missing these
I
questions.
can read out. Yeah.
Please.
Yeah. So we have a question from Doze. The question is, how can CSOs contribute to the local resource mobilization? So that's one of the questions. I also see a question from Christian. How can CSOs push private and public companies to invest more in malaria prevention, net distribution, using CSR resources? So those are two questions in the chat already.
So far. Okay, great. So Sis Rose, right back to you. Can I ask you to please answer the first question?
Yeah, so for the resource mobilization at country level, I think budget advocacy is one of them in terms of knowing when in your country are budget decisions being made. How does the cycle look like? Does it start in October? Does it start in December? When does it start? And then just being able to do some analysis to find out what are the gaps and what needs to be funded. And a lot of times we do know that we do not always necessarily have the budget analysis capabilities. And so because we have diversity of technical skills and capabilities, but I think looking at how we network and we collaborate with other networks. For example, we have budget advocacy networks, we have tax justice networks, we have colleagues who follow expenditure and track spending. So I think it's that, but also because resource mobilization and budget work is part of the national policy setting and allocation processes, I think continued advocacy for the inclusion, for inclusive governance, where impacted communities and civil society are part of decision making and are sitting at the national, country, stakeholder platforms, which is one of the benefits of the multi-sectoral arrangements that we have. Over.
Great. Thank you so much for that. So I am trying to figure out if you might have answered the second question while you were responding, Sis Rose. Do you think you could say you answered the second question?
So I think the thing to add, and colleagues who are working in malaria more closely can add to this. I think one of the opportunities around public-private partnerships in malaria prevention is that I do know in countries are spending like over $10 to distribute mosquito nets. And we do know from various analyses that it is possible to bring that number to a single-digit number where we lower the cost of, production and net distribution, and perhaps that is only made possible through private-public partnerships. But also happy to hear other reflections from colleagues who are working on this on a day-to-day basis.
Thank you so much for that, Sis Rose. While we are trying to figure out if Olivia will be back on, I'd like to just hand over to Lucille real quickly. Lucille, for you to please just translate those French points that seemed like they looked really important. So yeah, if you could please just jump on, Lucille, to assist with that translation.
Yes, thank you very much, Sibu. And my colleague also from Global Health Advocates. So we are the second co-chair of the C7 Global Health Working Group. Just translated the points in the written form in the Q&R box. But so you can see that Dr. Kalemai very rightfully recommend that national One Health policies be harmonized and that sustainable financing can be guaranteed. So thank you very much, Doctor, for your contribution. Back to you, Sibu.
Thank you, Lucille, and thank you, Jan, for that translation. And so, because we are very mindful of our time and making sure that we still get everyone to say what they needed to say on this very important webinar, at this point, I'd love to hand over for our special address to Ms. Serowit Brooke Landais, or Landais, our French Regional Counselor on Global Health for Eastern Africa. Over to you, Ms. Serowit. Oh, did I say that correctly? Did I butcher your name?
Good afternoon, everyone. And no, not at all. You didn't butcher my name. You said it quite well. I'm impressed. So thank you for the opportunity. Yes, indeed. And thank you for inviting me actually to participate and really listen to also the different engagements and discussions around the civil society's take on the agenda and the global health discussions currently that is quite dense, I could say. So I was asked to actually briefly come in to give more information on the Africa Forward Summit. Indeed, as you have discussed it in the last hour, it's really about gathering heads of states and different stakeholders around very strategic and common agenda between African states and nations and France. So it's going to discuss in different formats the architectural reform of financial reform. It does go as well into different sectorial discussions, let's say, in terms of blue economy, agriculture, health, and also artificial intelligence. And I just jumped into speaking in English because the whole conversation was going in English, but allow me to switch back to French maybe for some of the people connected that are French speakers. So, la France et les pays africains, en préparant ce sommet conjointement, est très important pour la France aussi de pouvoir tenir ce sommet en Afrique de l'Est pour la première fois. C'est une décision stratégique aussi pour montrer le nouveau lien qui s'installe avec le continent africain et aussi dans la continuité des différents sommets africains qui ont été tenus, le dernier il y a presque 10 ans sur le continent. Et pour faire le lien avec justement la priorité santé du sommet, la discussion autour de la souveraineté sanitaire, et bien sûr, en continuité de différents sujets qui ont été abordés ici, que ce soit la CRARICET, le SACA Agenda, mais aussi depuis l'année dernière avec le changement de financement international de différents secteurs, dont la santé. Ça a quand même propulsé les discussions sur comment continuer à répondre aux besoins des populations avec un changement de paradigme sur le financement de la santé et les ressources domestiques qui doivent être mobilisées davantage, qui n'était pas le cas jusqu'à présent. Donc les conversations autour financement de la santé et comment innover autour de ça, tout en sachant que depuis le Covid-19, le sujet de la souveraineté sanitaire est aussi un sujet d'industrialisation et de pouvoir vraiment développer le secteur de production de médicaments et de produits de santé dans la région, sur le continent, est un sujet politique qui prend de plus en plus d'ampleur. Et c'est aussi pourquoi au sommet Africa Forward qui va se tenir le 12 mai, le souveraineté sanitaire avec le focus de production de produits de santé sur le continent, en lien avec le financement de la santé, va être traité. Et ça, avec justement les interventions qui sont au niveau de chef d'État, mais aussi des différents parties prenantes, pour que justement on ne parle plus des projets ou de ce qu'il faut faire et de l'engagement des uns et des autres, mais qu'on passe sur des choses beaucoup plus concrètes, avec des annonces concrètes qui peuvent faire avancer le sujet sur le continent. Et pour ça, ce n'est pas juste une question de pouvoir le produire, c'est une question de qu'est-ce qu'on produit, de quoi on a besoin. Et finalement, ça dépasse le secteur de la santé en tant que tel, parce que c'est une question aussi de pouvoir façonner le marché, de pouvoir approfondir la formation des personnels impliqués, comme on vient de dire, et de pouvoir aussi créer tout ce qui est de pouvoir le partage non seulement de savoir-faire avec le transfert de technologie, mais aussi de pouvoir répondre aux besoins du continent, donc des questions de pool procurement, de questions de comment justement s'assurer qu'on répond aux différents besoins, je veux dire collectivement, Afrique et France et Europe et le reste du monde, et bien sûr avec tous les acteurs et tous les parties prenantes qui incluent bien évidemment la société civile. Je finis avec ces propos, et sauf si vous avez des questions particulières où je dois quitter la réunion malheureusement dans quelques minutes, mais je me permets de m'arrêter là pour avoir suivi les discussions que je trouve très passionnantes aussi. Je vous remercie.
When you said merci, I knew that was it. So I definitely need to learn French because that's important on these platforms. But thank you so much for giving us an idea of what to expect from the Africa Forward Summit and how important it is. I may not be there for the summit, but I really feel like through the statement, my voice and my views are being represented. So thank you so much. And so because of that, I would really like to encourage everyone. The link is in the chat box to sign on to the statement and show your support and solidarity for the statement, making sure that it's a statement that our African leaders get to hear, and they understand that it is coming from the collective voices of African civil society and community. So the statement has been put on. Please follow the link below on there to sign on and show us support for this statement. I want to go quickly back to Carol. So thank you so much to Maserawit Brooke Landay the French regional counselor, for those encouraging words. So thank you so much. And to kind of start wrapping up our session, Olivia, I see that you are back. So if you could please just give us one thing you would say, and I'm mindful of your connection, one thing you would say to your president or to your health minister leading up to the Africa Forward Summit and what they should be prioritizing. Over to you.
Hello, CB. Are you talking to Olivia?
Yes, Olivia. Yes, to you.
Yes, sorry.
Yeah.
I'm so sorry about the connection, but it was great to hear the intervention of everyone. So just one thing. No health Africa sovereignty without financing. So we need to walk the talk and ensure that all the actions and the decisions we take are actually backed up by financing from both domestic and also in solidarity with France. France has been a great contributor in global health, especially in Africa, and we need to sustain the gains. Thank you.
Thank you. I love that. So basically, that call to action is clear. Let's put our money where our mouth is. So thank you so much for closing us off on a real high there, Olivia. And thank you so much for being here as well. So I've got some closing remarks here from Mr. Alan Raji, the Executive Director of Kanko. I'd love to hand over to you now before we close off. Over to you. Do we have Mr. Allen on our call, on our webinar today?
Thank you very much.
Yes, here we go.
I appreciate, and first I want to thank our Sham, Dr. Bukose, if you're still there, and other elected members of parliament. I want to appreciate my colleagues, Rosemary, Nawina, and the rest, and Dr. Buyari. I think the most important is we must be able to speak on behalf of our people and ensure that whatever is said, they are comfortable doing whatever they do, and they differ. In terms of what we have covered, we have looked at the issues of financing and governance shift. That needs to happen that in terms of transition from donor dependency, we must have a sustainable domestic health financing, which is predictable and which people can actually be proud of. The second thing is to prioritize efficiency, accountability, and value for money. There are a lot of people who are talking of access to health, but it's a struggle, a big struggle. We have to look at the enforcement of country ownership, issues of leadership and decision making. And I'm happy that our colleagues, members of parliament, are here to join us. We want to align the investment. Remember what Dr. Bujari said, that it is not just doing it, but it's part of development agenda. We need to have measurable outcomes and impact. In terms of other things, we are looking at issues of the security, sovereignty, and my colleagues have actually been able to look at issues from different perspectives. The issue of capacity and independence. We are looking at local manufacturing. We are looking at positioning health as a national and environmental security issue. We are looking at strengthening public institutions. Basically, if we get the correct data, we do the right investment. And then the issues of building resilient, relevant systems. Finally, how we shape the summit discussions, we need to have a stronger focus on domestic resources mobilization. It cannot be anything else unless we do it at a country level, at an African regional. We cannot be seen to be working. Our parliaments, our communities need to be pulling together. There is the need to expand the issue of local manufacturing as much as we want to look at the diseases, whether malaria or others, those products must be coming from ourselves. We need to look at how to accelerate local production and supply chain infrastructure. And finally, we need to look at integration of health security, economic growth, and development. And then emphasis on country-led implementation. A lot of speakers have talked about country-led, country-managed. So basically, in terms of key takeaway points, a strategic shift, we need to come from dependency to self-reliance, resilience, and sovereignty. We need to look at to come from issues from fragmented efforts to coordinated and continental-wide action. We need to come from commitments to reality, to issues of implementation, issues of accountability and results. We don't want to have statements. We want to have commitment. From then we need to look at issues of vulnerability. Carol have actually talked about this. Cannot be better said by a person who have lived it, where we are looking at the preparedness, issues of equity and strategic autonomy. Thank you very much, and I look forward to meeting you in Nairobi. Thank you. And for all
Thank you so much, Prof.
Thank you very much.
Yes. Thank you so much, Prof, for those final words and just wrapping up everything so beautifully for us. And we've heard today from all our speakers. So thank you so much to each and every one of our speakers, from all the members of parliament, civil society leaders. Thank you so much to each and every one of you for being here. And we've heard a consistent theme here today, and that is for the Africa Forward Summit to be a success. The partnership between Africa and France must be reimagined on equal terms. Whatever we discuss needs to be made sure that it is on equal footing between Africa and France. And as we wrap up, I want to leave you with this final thought, that health, serenity, and solidarity is really two sides of the same coin. We are stronger together if we advocate together. So thank you so much to each and every one of you for joining this. It's been an Things really happened there at the end. Can everyone still hear me? But it doesn't matter because now we're at the end. Thank you so much, everyone. Thank you so much for your time and your passion. Let's keep the momentum going as we head over to Nairobi. Stay safe and goodbye for now.
Thank you.